The annual report of the International Narcotics Control Board for 2013 marks a particular milestone. This is the 45th annual report since the board was established in 1968 in accordance with the Single Convention on Narcotic Drugs of 1961. Over that period, significant efforts have been made in addressing the global drug problem. The three international drug control conventions enjoy a nearly universal adherence. The recent developments in Uruguay and the US states Washington and Colorado challenge the international drug control system.
Yes, indeed. These developments do pose a very serious challenge to the international drug control system, and they represent a grave threat to public health. Actually, we should remember that most drugs were made legal by UN member states when they ratified the three UN drug control conventions. However, considering the risks drugs represent for health, they just decided to limit their use to medical and scientific purposes. Member states decided, therefore, to classify those drugs in various tables according to the risks they represent for physical or mental health. And they requested our institution, INCB, as a fully independent and quasi-judicial body to monitor the implementation of those decisions, regulate the production and international illicit trade in those drugs, and advise the countries in case of difficulties. So member states themselves have recognized the danger posed by cannabis abuse and committed themselves to the full implementation of the convention. We should remember that the international drug control system is based upon the principle of shared responsibility and relies upon universal implementation. Therefore, as some decisions adopted in Uruguay and USA concerning cannabis use are not in line with the decisions taken unanimously by the international community, INCB is indeed engaged now in an ongoing dialogue with the governments of those two countries on these issues.